Hello and welcome to the December 17th, 2024 Health and Ed Committee meeting. And we can get started by calling the roll.
Commissioner Oliver.
Present.
Commissioner Davidson.
Here.
Commissioner Wilson.
Here.
Commissioner Boyd.
Here.
Commissioner McMurray.
Here.
Commissioner Gooch. Here. Chairman Dodd.
Present.
Thank y'all.
All right. And apologize for being late. We've had some competing schedules tonight, and purchasing just got wrapped up, and the mayor and I had to have a conversation, so we're a few minutes late. So thank you for your patience. Do we have any public comments? All right. We will jump straight into our first item is Health Department Director Byron Cumbie. We have a Health Department item on the SharePoint as well.
Are we going to do approval of minutes?
Thank you. Thank you. And we will entertain the minutes before Mr. Cumbie gets started. Vice Chair Wilson.
Thank you, Chairman. I have reviewed the minutes from our last meeting. I find them to be in order, and without objection, I move for their approval.
All those in favor signify by aye. Any opposed? Great. Thank you, Vice Chair. Thank you, Commissioner Oliver.
Thank you, Chairman Dodd. Your health department continues to do good work for the people of Rutherford County, and we are indeed proud to serve. You should have our November outreach report hopefully made available to you there electronically. In keeping with our mission to protect, promote, and improve the health and well-being of all people in Tennessee, as we protect in that first column with our disease intervention efforts, immunizations, environmental inspections. The second column there, we promote with health outreach, community participation, and vital records administration. And then there in the third column, we improve with our primary care services, our dental services, our WIC, family planning. All these programs are operational, on track to meet or surpass our set goals. Respiratory viruses in Rutherford County are still low according to the CDC's, COVID-19 that is still low according to the CDC's hospital admission metric. There is some slight rise in the early indicators such as test positivity. That is really the only category we've seen a rise in. But that does indicate that perhaps that our winter season is starting to be underway with that. Emergency department visits are still flat. Severity indicators like hospitalizations, deaths are unchanged from last time I reported to you. The new COVID vaccines are available, and recommendations are anyone 6 months or older be vaccinated to prevent severe illness, particularly those 65 or older or those that are immune compromised. The new COVID shots are widely available in pharmacies, doctors' offices, and in our clinics by appointment from Monday through Friday from 8 to 4:30, 615-898-7880. Just call that number. We'll get you scheduled for an appointment. COVID testing by mail, this is something I've talked about previously. This is where you get 4 free tests sent to your home, 4 free tests per household from the U.S. government. That web address is covidtests.gov. That's test with an S to request those 4 free COVID tests this winter. I watched someone sign up for this just today, and it took about 30 seconds. It goes directly to the U.S. Postal Service. You put in your name and address, and they get sent to you. And that's just another way of when someone in your household becomes ill, kind of knowing what you're dealing with. They also have a phone number. It is 1-800-232-0233, and that's so 2 different ways you can request those tests. Flu and influenza like, yes, sir. 1-800-232-0233. Absolutely. And flu and influenza-like activity in many regions statewide has entered the moderate range. And that is in our county, in our region as well. Hamilton County is considered high right now. In our Mid-Cumberland region, 4.2% of outpatient visits were reported as being flu or flu-like illnesses. Anywhere from 3 to 5% is considered moderate, so we're still in that moderate category. And that reporting is done from the Sentinel providers, and that's actually a broad swath of primary care, pediatrics, county health departments, student health centers, and emergency departments. And they sample 100 across the state to get those figures. Flu shots are available as a walk-in service in our clinics from 8 to 10 or 1 to 3, so no appointment necessary during those hours of 8 to 10 or 1 to 3, Monday through Friday. Getting a flu shot in December will offer protection until the end of flu season in the late spring. In other updates, naloxone or Narcan, this can help turn around an opiate overdose. Those products are now available free of charge in our health departments and in all health departments in Tennessee. We've made some progress in opioid overdoses in Tennessee, and we hope to make more by making these products available. Anyone can go to the health department and request it. They'll be provided with an overdose reversal kit and instructions on how to use that at no cost with no questions asked. And finally, in current events, our offices will be closed on December 24th and 25th in observance of the Christmas holiday, and then one week later on December 31st and January 1st in observance of New Year's Day, in keeping with state office closures. That concludes my report, Mr.
Thank you, Chairman. Questions or thoughts, or we'll entertain a motion to approve?
Mr. Chairman,
Yes, ma'am.
I have a couple of questions.
Mr. Wright.
Director, how did you say that flu is measured? That metric, how is that measured?
So that is positivity rates from outpatient visits, and it is 100 Sentinel providers across the state, and these are primary care centers, pediatrics, health departments, student health centers, and emergency departments. So they try to take a broad swath there so they get a fair appraisal of the flu that is circulating.
And that's deemed moderate.
Yes, anywhere from 3 to 5 is considered moderate. In our state right now, only Hamilton County is reporting as high.
Okay. My question is related to the COVID metric. Is there a reason why you can't utilize outpatient, or why it's not decided to utilize outpatient visits to look at COVID? And the reason why I said that, I live on a cul-de-sac, and 4 families, homes of 3 or more were hit with COVID here recently. But you're just saying the only metric that you're measuring is hospitalization. I'm wondering, is there a reason why? Because it's evident that it's still in the population and it's still making an impact. So I'm just curious why they're choosing to use a different metric with COVID versus flu.
Yes, ma'am. There are other metrics. There's test positivity as well, and that's really the only place we've seen the increase with COVID. I only have that information available on a state level. Community level, I'm able to get hospital admission, but it's statewide. So really, test positivity, we have seen a rise in that, so that would be in keeping with your cul-de-sac example. But as far as emergency department visits, hospitalizations, and deaths, which those tend to trail behind, but those are still low. But by all indications and historically what we've seen last year, we are starting to see our winter rise.
Thank you.
Any other thoughts or comments or a motion to approve report? Second. All in favor, say aye. Any opposed? Thank you, Director.
We did have one more item tonight. That is requesting to get the mayor's signature on a contract with Seracom. This is the provider, the vendor for virtual interpretation services. So this is the iPad-based virtual interpreter service. The courts here in Rutherford County already use this same vendor. This contract is funded by the state. It was part of our grant contract, and we did last time we met, you all approved to move that into our budget line item so we could pay this vendor. So this would be the final step in that. It is funded by the state, but they do request that the contracts be signed with each county, and that's why we are requesting that before you.
Motion to approve.
Call the roll, please.
Commissioner Oliver,
Aye.
Commissioner Davidson,
Yes.
Commissioner Wilson,
Yes.
Commissioner Boyd,
Yes.
Commissioner McMurray,
Yes.
Commissioner Gooch, Chairman Dodd.
Yes.
Thank y'all.
Thank you.
Thank you, Chairman.
That does conclude. And Merry Christmas to you, Director. Next item on our agenda is CCRC. Those minutes are on your SharePoint. One item I noticed when reading the minutes, at times we just noticed that they have a lot of openings. They did hire 9 people recently, or 4 rather, and have 9 openings. So just FYI, I've seen that the open positions decrease at CCRC, which is good news. Next on the agenda is the school board, and we have item A is a budget amendment, and Brian Runyon will present that, and then Dr. K. Martin will go over the items B and C.
Good evening, Chairman, Commissioners. We've got one budget amendment tonight, and this is regarding our Fund 141, which is our general purpose school fund. This amendment is to increase general purpose Fund 141 budgeted revenues and expenditures in the amount of $980,385 to recognize the awarded state special education pre-K grant for FY 24-25 and the FY 23-24 carryover amount. The funds will be used for additional educational assistant positions, assist in the pre-K classrooms, additional training for teachers and EAs, sensory and de-escalation items, and supplies and materials for the IPK classrooms. This grant will ensure that all students will have access to highly trained teachers and staff and meet their educational needs. This is a reoccurring grant and requires no local match. And we also had this grant last year that this body approved. So.
Motion to approve.
Thank you for that. Any questions or discussion on this motion? Commissioner Gooch.
Is this a state grant or a federal grant?
It's a state grant.
And it is reoccurring, and so that, of course, makes me feel more comfortable that it's for salaries and these recurring expenses.
But it's not a pass-through grant from the federal government. This is state.
It's not. It's a state grant that they, for the IPK, for they have a voluntary pre-K grant, and this is their IPK version of that voluntary pre-K grant, but it comes directly from the state.
Any other questions or discussion? We have a motion and a second, and we will call the roll.
Commissioner Oliver,
Aye.
Commissioner Davidson,
Yes.
Commissioner Wilson,
Yes.
Commissioner Boyd,
Yes.
Commissioner McMurray,
Yes.
Commissioner Gooch, Chairman Dodd.
Yes.
Thank y'all.
Thank you, Mr. Runyon. Dr. Martin, welcome back.
Good evening. Good to see you all again. The last time that I was here, I think Commissioner McMurray mentioned a one-pager, so I came back with a two-pager for you. But the first page is just a Rutherford County at a glance for you, just some general information, maybe some talking points as you have constituents ask you about Rutherford County, just an overview for you to have in general. On the back side of that handout, you will see just, again, our new board members and our current board serving for us and Dr. Sullivan. And then here at the bottom, here's just some bullet points of some things that I wanted to share with you for our update for tonight. First of all, thank you for allowing me to speak with you. I am speaking for Dr. Sullivan. We are having a zoning board meeting at this same time, and so he is there with that at this time. Wanted to let you know, I know that you know that we are a level 5 school district, and this is our 3rd year in a row. You're also aware that we had 32 level 5 schools, but since we have seen you last, we also have added to that our 19 different reward schools. So I wanted to make sure that you were aware of that celebration. And then Smyrna High School, just for you to have this information, we will be having a ribbon cutting ceremony for that addition that you funded for us, and that will be in January, so please be expecting an invitation to that. And again, thank you for your support in that area. We have began the budget process for the next fiscal year, 25-26. Dr. Sullivan started speaking with the leadership team this week. He has sent out a timeline to all of the board members today. We sent out budget instructions for our principals today. We will have a follow-up Zoom meeting where he'll go into further detail tomorrow and answer any questions that the school may have as well. And then typically we meet with each 51 schools and start putting that budget together for you. I know that Dr. Sullivan has mentioned to you all several times, not just this year, but in the past, we are still predicting that this will probably be the year that we will need more than our maintenance of effort than we usually have to balance that budget. So just want to get that on everyone's radar again as we begin that cycle. And then also, since we have seen you last, we've had 2 new letters of intent for our charter schools in our area. Both of those letters of intent included elementary schools. Both were in the Smyrna and Laverne area as well. And then our enrollment numbers, I know you're always curious to know our new enrollment. As of yesterday, we had 5,288 students in our district pre-K through 12.
Very concise. Prepared.
I do not have that information, but it was 2 elementary, and we already have 3 in the Laverne and Smyrna area, and this was the same area they were interested in starting again.
Commissioner Wilson.
Thank you, Chairman. When do you expect to have your first estimate of what your ask above maintenance of effort would be?
Yeah. Does this help, Brian? This is y'all's schedule, if that gives you any context.
We're actually going to have the department head, so we'll meet first with each individual school in January and February timeframe. We're looking at department head meetings as well around the March 3rd through the 7th that week. So once we get those individual meetings out of the way, then we'll have more of a clearer picture of how much we're looking at with, we've got a couple different situations that we're looking at. Obviously, new school opening, going to have to fund those positions. 2 additions, 3 additions, 2 or 3, 2,
3 including
3 additions that we're going to have to, including Laverne. And then also to meet the state mandated amount of bringing all teachers to 50,000 starting salary by 26. We're also going to have to add, additional, I think we're going to start off with and look at 2.5% increase. So with that said, we should probably around the 1st of March is what I'm looking at time frame wise. We could possibly get a little bit closer to it, or we can just give an estimate before then, but I'm thinking we'll have a more solid answer around March or the middle of March.
And where I'm going with this is it's a little ambiguous at this moment what this figure is going to be, and this is my concern just for everyone to have on their radar. We're going to be asked to fund a middle school, and I just feel like the commission should know in the discussion, because it will come up. I would rather us know it's going to come up front. We probably need to have a decent estimate while we're considering funding a $90 million approximate middle school. We should probably have in the conversation what we'll be facing with additional millions of dollars in that operational budget. I think that's imperative for me to say that, because I know right behind it is coming funding for design of a high school and a high school. I just think those need to come together. Our budget committee needs to have both of those. I don't know how you fund one without the other when we're threading a needle on how many millions we can afford without a property tax increase to increase our budget. So I just want to say that tonight, months ahead of time.
And as soon as I can get it, close to a number that would be worth putting out there, we definitely want to have that conversation. As of right now, the way preliminary numbers look and what we're facing, it looks like we will start out I mean, I wish I could say I could balance the budget, but we may be budgeting in a deficit to be able to fund, you know, the opening of another, the elementary school and then the 3 additions, and then that's what we're projecting right now, unless there is some additional income, revenue or income that comes in that we're not aware of, so.
And Dr. Martin indicated that mentioning the MOE tonight, I'm grateful that, as you've done, Commissioner Wilson, for the last several months, just keep this budget out in front. Let's be aware. It's a tough topic. So we are in December. The principals are meeting the 18th of. You've got my schedule, Brian, but the principals are starting to meet. So everybody is already starting to work on the budgets. Department heads meet in February, and we have our joint meeting in May the 27th, 2025. So I think just the fact we're talking about MOE in December suggests that we're ahead of the game, and let's just keep the intensity on to ask that. Budget priorities for the school board is in February the 6th. And Phil, you've been good about indicating high school land, opening a middle school. Had Laverne on the radar. It's come to pass. Please keep us appraised of. I think you've got a really good grasp of the numbers and the impact over the next few years. So thank you for that. So we've heard a report on the Board of Education and Enrollment, and a little bit of budget talk. Is any other questions or discussion? I don't know that we can have a motion to approve the report.
I move that we accept the Board of Education report.
All those in favor say aye. Any opposed? Thank you, and thank you, Dr. Martin and Mr. Runyon. Merry Christmas to y'all as well. That concludes our business. I know at the last commission meeting, Commissioner Phillips handed out the budget calendar and the joint meeting, so please review that. Budget's going to become a big topic starting now. And our next meeting in January will, as Commissioner Wilson said, we will be talking, let's stay in front of this budget and keep this on the horizon. Any other business for this committee tonight? I'll entertain a motion to adjourn. We adjourn.